Hi, this is Lucy Sullivan interviewing Anita Schneider on January 19th, 2012. Anita, name where and when you received your credentials and where do you currently work?
Okay, sure. I am currently registered in EEG, evoked potential, and intraoperative monitoring. I received my first credential in registry in EEG around 1975, and my evoked potential credential in the 1980s. My intraoperative monitoring credential in 1995 or thereabouts. I also plan to take my certification in long-term monitoring this year, 2012. Currently, I am enjoying retirement for the past 2 years, having retired most recently from Jordan Neuroscience here in San Bernardino, California, but I do still do some work on some special projects.
What drew you to EEG and diagnostics?
Well, I was actually fortunate enough to kind of fall into this profession in 1964. When I was 19 years old, I was working as a receptionist for a psychiatrist, Dr. Walter Massey, in my hometown of Mansfield, Ohio. At that time, he had the only EEG machine for miles around. He had a technologist or a technician, as they were called in those days, drive to his office on Saturdays from Columbus, which was about 3 hours away, to perform the EEGs on outpatients who were his patients. She worked at Riverside Hospital during the week in Columbus, and that was probably the nearest hospital to Mansfield at that time. I became interested in watching her do the testing and also schedule the appointments for her. In time, our patient volume grew, so Dr. Massey asked if I would be willing to learn to do EEG. He knew a neurologist in Chicago, Dr. Frederick Gibbs, who had agreed to take me as a student for 6 months to work with he and his technologist at the University of Illinois. It seemed like a good idea to me since I did not want to be a receptionist for the rest of my life, and I had no interest in working at the restaurant that my parents owned in Mansfield. So I did go to University of Illinois and completed my 6-month training there. I guess I met their expectations because they did offer me a job to join Dr. Gibbs' private office there in downtown Chicago. However, I opted to return to Mansfield to work with Dr. Massey and marry my first husband. I worked in Dr. Massey's office until I moved to Toledo, and then I did train another technologist before I left Mansfield. In Toledo, I started a one-woman lab in Norwalk, Ohio, and I used to send the paper recordings to Dr. Massey for his interpretation. He would then send his reports to the referring physician. And I also set up a lab in Fremont Hospital and sent the recordings to a young neurologist in Euclid, Ohio, Dr. William Bauer. Eventually, I moved to Euclid and started the lab at Euclid Clinic, which is now University MedNet with Dr. Bauer. I was there for 16 years before moving to Redlands, California, where I really entered the most exciting phase of my lung career, working with a wonderful neurointensivist, Dr. Kenneth Jordan, who turned out, little known to me at the time, to be a pioneer in the use of EEG in critical care patients in the ICU. This position was really the most fulfilling for me, I think, of all my years. I learned so much from Dr. Jordan, who's a great teacher, about the value of neurodiagnostics in monitoring critical care patients in the ICU and also in the ER. He encouraged me to grow, to lecture, to publish our research. I worked with him for 16 years until my retirement from full-time work about 2 years ago.
Was EEG a popular specialty when you were starting your career?
Lucy, it was very rare at that time and very new.
Who were your early mentors?
Well, my earliest mentors would definitely have been Dr. Gibbs and his wife, Erna, who was one of his technologists at the University of Illinois.
What were your earliest career influences?
In addition to the physicians that I worked with, that would definitely be the EEG organizations that I've been affiliated with really my entire career. The first was OSET, the Ohio Society of Electro-Neurodiagnostic Technologists. It was organized about the same time I was entering this field. primarily through the promotion of the Cleveland Clinic group at that time, which was led by Dr. Charles Henry and his technologists. I began attending the annual meetings and networking with the technologists from Ohio. We also had tri-state meetings with Ohio, Indiana, and Michigan, which expanded my network for sure. And then in the early 70s, I became involved with ASSET, which has really provided me the best opportunity to learn more and stay up to date with the changes in my field. Attending workshops and meetings really is what helps me prepare for examinations and become registered and certified in neurodiagnostics.
If you had not become an EEG technologist, what would you have liked to have done?
You know, I think perhaps architecture or some kind of home design career of some sort. I'm really an operations person. I like to be creative and make things work.
Why do you think this field took off when and how did it?
You know, this question interested me because I actually think neurodiagnostics has been quite slow to become a recognized profession. Unlike other modalities that began about the same time, like EKG and even some imaging studies like CAT scans, it's really only in recent years that our profession has become widely accepted. And I think we are still a bit behind the curve in utilization of the full value of neurodiagnostics.
What equipment did you train on, and what were the main limitations of it?
Well, back when I went to University of Illinois, I trained on an 8-channel Graph Model 3. In those days, we really did run the machine, and maybe drive the machine is more descriptive. We started each day by adding water to the car-type battery that was in the cabinet of the machine. There were vacuum tubes in the power amplifiers and each channel and preamplifiers. There were multiple dials and switches to adjust the settings like the sensitivity, and the filters for each montage had to be dialed into each channel every time we changed settings. All the patients were done in the lab, inpatients and outpatients. Every EEG lasted an hour and a half to 2 hours, and we were required to obtain sleep on all patients, if at all possible, to record the most likely state of somnolence to elicit abnormal EEG patterns. The equipment never left the lab. There was no EEG monitoring in the operating room, in the intensive care units, which were just being created at that time, or the epilepsy monitoring unit.
What other equipment have you used over the years, and could you summarize the pros and cons of each?
Well, I worked with many different types of brass equipment, instruments, which were essentially the only equipment manufactured prior to the 1980s. In the 1970s, the equipment became more modern, with circuit boards replacing vacuum tubes. Then there was a huge change in the technology in the 1990s when digital equipment replaced the analog system. I remember at the time, I and my fellow technologists said it would never happen. Now I can't imagine going back to a paper system. I've used several models of neon codon, EEG, evoked potential, intraoperative monitoring, and nerve conduction systems as well, and also Catalyl, Tekka, and Biasis.
What memories do you have of your training program?
I remember my initial trip with my parents to Chicago. I lived in the student nurses' dorm, and I remember feeling anxious and excited about my new adventure. I was so young. I had no idea at the time what a pioneer in the field Dr. Gibbs was. He and his wife, who was his original technologist, grew their EEG lab and did constant research from the vast patient population that they served in the Midwest. Patients came from all over for this new testing. He published the results of his research and is responsible for identifying and naming many EEG patterns that we continue to use today. I watched and learned from his 3 technologists how to apply electrodes with collodion and perform hyperventilation and photostimulation. They included me in social outings, and as I look back, I'm sure they were just looking out for that kid from Ohio.
What are the main ways in which the field has changed over your career?
Well, there have been many clear advances in technology, but I would say that our field has remained rather stagnant for many years, with few changes in the way we did things and the utilization of neurodiagnostics. During the past 10 to 15 years, there have been many advancements.
How has scientific knowledge changed the field, and what do you think were the big breakthroughs?
I think one big breakthrough came through the knowledge that long-term monitoring is so much more helpful than a routine 20 to 30-minute test. Also, that physicians in specialties other than neurology now recognize the value of neurodiagnostics. Neurosurgeons and orthopedic surgeons use it for monitoring during and after surgery. Intensivists, as well as neurointensivists, use it to monitor patients in all ICUs, adult, pediatric, and neonatal. Epileptologists use EEG to accurately diagnose seizure disorders. Also, intraoperative monitoring has become a standard for brain and spine surgery. Epilepsy surgery monitored with EEG has changed the lives of patients with intractable seizures.
What are the 2 to 3 big issues in EEG that people are working on to solve today?
Well, ASPET, the American Society of Neurodiagnostic Technologists, is certainly working on how best to market our profession. There is a shortage of qualified neurodiagnostic workforce, yet there are not enough formal neurodiagnostic training programs to train folks. Educating current and future technologists is a key focus.
What are the main areas of professional discussion or disagreement going on today?
I think probably how best to grow our profession to meet the demand, how to add real value to the level of the technologist through certification and or licensure.
What are you most proud of in your professional life?
You know, I'm proud of really all that I've done throughout my career, the patients that hopefully I've helped, and the technologists that I've mentored. But more than proud, I'm really grateful for having and acting on the various opportunities that I've had. I'm grateful that Dr. Massey asked me to go to University of Illinois and learn to do EEGs. I'm so grateful to have actually worked with and have been trained by an icon in the field, Dr. Gibbs. I'm grateful to know what it's like to start and build departments from a one-person lab to large labs with satellite clinics. And, of course, I'm grateful to have worked with Dr. Jordan in promoting the value of EEG in critical care. I'm also very proud that my daughter, Melissa Burke, chose neurodiagnostics as her career. And actually, we had the opportunity to work together during my last 10 years with Jordan Neuroscience.
Where do you see the industry in 10 years?
I see our industry continuing to grow, especially in the acute and critical care areas, especially for traumatic brain injury, with EEGs being routinely performed in the emergency room, in the ambulance, and on the battlefield to diagnose brain injury in time to make a difference in patients' outcome.
What's the best piece of advice that you've ever received?
My mother used to tell me, don't let fear of failure hold you back. Take a chance. What's the worst that can happen? It's been good advice to use throughout my career and my life.
Is there anyone else in EEG that you think we should talk to?
Well, other than the obvious people that have been icons in the career in the past in our profession, I would suggest you interview Fran Petalty. Fran was instrumental in really running our organization ASPET for so many years, and I think she would be a volume of knowledge. And I would also suggest Aileen Portner, Portner. She worked with Dr. Gibbs for many years at the University of Illinois.
Okay, that'd be great.
She'd be an excellent one.
Good. Okay, I'm going to go ahead and turn off the recording.
Okay.